There's been a lot going on in the world right now, especially within our communities, and especially at the start of a new school year. It makes things hard.
Some parents might be wondering how to talk to their kids about mental health and what to do if they notice that their child is struggling. So joining us with tips for families, Dr. Gigi Chawla, Chief of General Pediatrics over at Children's. Thanks for being here.
I'm glad to be here.
I'm glad we're talking about this. It's something we've been talking about more and more, but where do you even start when you talk about children's mental health?
Oh, gosh, such a good question, and there are lots of things that are kind of whipsawing families into thinking about it now. But really, it's about starting the dialogue as early as possible by things like just having open communication with your kids, even at a young age.
How young?
Like 2, 3, 4, starting to check in by naming their feelings.
I was going to say, because sometimes kids, they can't communicate their feelings. They don't have the words to verbalize it. So how do you do that?
Right, and in some families, even having some of those discussions about how you're feeling today isn't a normal part of your day.
It might just be stop crying.
Yeah,
That's
just stop crying. Right, exactly. And so giving voice to what you're even experiencing as a parent. Oh, I'm having a sad day, or I'm having a really happy day. I'm excited about this. That gives permission for kids to have those same feelings and for that dialogue to happen naturally.
What happens when you get more towards, like, so the middle school and the high school then? How do you recommend parents check in with their kids there?
Yeah, first of all, it's really a lot of listening. It's a lot of making sure you're in the same room at the same time, that you're setting up the scenarios to have open dialogue that you've already been building, right? Maybe that's family dinner time, maybe it's some of those times in the car, whatever that is, but setting it up where you're really being able to get to that deeper level to talk about what's happening, what are you feeling, this is what I'm feeling, and setting that up, and then looking for some signs that might give you concern. Things like, you know, how kids start to feel things in their body. They might feel stomach aches, they might feel headaches, you might see changes in sleep patterns. That could be all a key to really having a deeper discussion about their mental health.
So is that the key then? Is it the stomach aches? Is it I'm feeling a headache? Is it before those things that happen before school? Are those signs that, you know what, maybe we need to get some professional help?
Those are signs that you should absolutely start engaging in the discussion about, let's talk about, you know, what you're noticing with your body, and do you think that it might be because of X and Y and Z, and reach out to your pediatrician for help in having some of those discussions. In that dialogue, you might find out that, these are discussions that you need to have with a mental health expert, or you might find by just naming it as a parent, you might not need those other experts too. So it is about starting the dialogue early enough to understand if the problem that you're seeing is needing professional help.
All right. Well, as always, Dr. Gigi, thank you so much. We really appreciate it.
Good luck.